everyone, Susie here from Lupus South Africa and Andrea's Gift. We have another trial. It's an open label trial, which means all the patients involved in this trial gets the real medication. There's going to be inclusion and exclusion criteria, but you can call Dr. Lorraine. I will include her number, email on the screen and on this post. The trial is at Biomed Research Center in Polokwane, Limpopo. Warriors as far as Pretoria can apply for the study because they will pay travel and accommodation. So please do not comment on this post. Contact Dr. Lorraine, WhatsApp, email, or call. The inclusion criteria, those criteria that will include you in the trial. So you can go for the trial if you have these criteria. Number one is an ACR or EULAR diagnosis of systemic lupus erythematosus, cutaneous lupus erythematosus, primary Sjögren syndrome. For example, you don't have lupus first and then Sjögren's, you have Sjögren first, and then diffuse cutaneous systemic sclerosis, and also polymyositis. Number two, participants with systemic lupus erythematosus, cutaneous lupus erythematosus, diffuse cutaneous systemic sclerosis must all be willing to go for a skin biopsy. And then polymyositis patients must then be willing to go for a muscle biopsy. Number three, between 18 and 75 years of age. Number four, stable but active disease. Number five, photographs of skin lesions if you have systemic lupus, cutaneous lupus, and sclerosis and Sjögren's. Number six, capable of giving signed informed consent. You must be able to sign your name. Number seven, use a highly effective contraceptive measure. They say this because you cannot fall pregnant while using this protocol. It is disastrous. That includes the inclusion criteria. If you have any questions regarding these, remember to contact Dr. Lorraine. Do not comment on this post. Now, we're starting with the exclusion criteria. Now, one of these criteria, if you have one of them, you are excluded from the trial. You cannot take part in it. Number one, severe manifestation of the selected autoimmune disease. If it's severe, they won't allow you. Number two, receipt of super high potency topical corticosteroids, meaning you have a very high dosage ointment of steroid. For example, propopanoate and fluocinamide. Number three, if you received a dose change in your mycophenolate mofetil, that is Celsep, methotrexate, leflunomide, azathioprine, or any immune suppressant that is not a steroid. If you received a dosage change within 28 days of this trial, it will exclude you. Number four, required regular use of medications known to cause a major side effect like dry mouth, dry eyes, which have not been on a stable dose for at least 30 days. That will exclude you from this trial. Number five, if you received any of the following medications within 6 months of this trial: cyclophosphamide and leflunomide with a higher dose of 20 milligrams a day, and Abtacet. This will exclude you from this trial. Number six, if you have received monoclonal antibodies mimic natural antibodies to help fight infection, or which is rituximab, or any experimental immunomodulator within 28 days of this trial, you will be excluded. Number seven, if you've received rituximab or any other B-cell depleting biologics within 6 months. So check your biologics with Dr. Lorraine first. Number eight, receipt of rituximab or other biologics without a return of CD19 and CD20 count that's above the lower limit of normal. Number nine, receipt of alemtuzumab, bone marrow transplant, stem cell transplant, total lymphoid irradiation, CAR T-cell, or T-cell vaccination therapy. Any of those will exclude you from this trial. Number 10, known history of primary immune deficiency, which is the HIV, Any history of that will exclude you from this trial. Number 11. Participants with the following blood tests will be excluded from this trial. AST level higher than 2,5, ALT level higher than 2,5, total bilirubin higher than 1.5, total immunoglobulin smaller than 500 grams per deciliter, your neutrophil count lower than 1,000 microliters, lymphocyte count lower than 300 microliters, glomerular filtration rate or GFR of lower than 50 milliliter per minute per 1.73 squared meter. Number 12, history of hypersensitivity or anaphylaxis to a monoclonal antibody or human immunoglobulin therapy. Number 13, active infection or a history of serious infections as follows. Use of antimicrobials within 30 days, history of opportunistic infections in the last 2 years, recurrent chronic infections, symptomatic herpes zoster within 3 months, that's shingles, a history of tuberculosis, or any history of viral hepatitis will exclude you from this trial. That's number 13. Number 14, if you had a major surgery within 28 days, will exclude you from this trial. Number 15, contract and recover of the heart, the QTC, is higher than 480 milliseconds based on 3 ECGs taken. Number 16, evidence of significant uncontrolled concurrent disease, for example, COPD, chronic obstructive pulmonary disease. Number 17, previous exposure to DR0201, which is the protocol included in this trial. Number 18, participation in a clinical trial, 3 months for biologics and 1 month for non-biological therapies. Number 19, unstable lifestyle factors, including but not limited to excess alcohol, heavy nicotine use, or substance abuse. Those factors can exclude you from this trial. Remember, do not comment on this post. Contact Dr. Lorraine and discuss with her your inclusion and exclusion criteria to see if you can take part in this trial. Thank you very much for watching, and remember, giving up is not an option. Bye.